Well, thank you, Speaker, and I'm delighted to pick up where I left off. But in the interim, Speaker, I had the opportunity to further reflect upon some of the wonderful announcements that were involved in the Blacktown and Mount Druitt Hospital redevelopment. I must confess, it's made me jealous. One of the things that I talk about ad nauseum in my electorate is the $479 million rebuild of Ryde Hospital, the single largest investment in healthcare in my electorate's history, as best as I can understand. And that has left the Ryde electorate over the moon. It's something that my predecessor was proud to announce and deliver, that I've now got the honour of implementing. And I have to say that when I think about the way that the government have been responding with this motion and the criticism and condemnation, I'm upset. I feel for the constituents of the members' electorate, because they have got an even better deal than we do in Ryde, and yet in Ryde we're very, very happy with our hospital redevelopment. So I was speaking before about some of the great services, and just as I go through them I'm just more and more impressed, but I wanted to share with the House some of the wonderful details. I spoke about the new inpatient building that was adjacent to the existing hospital. There's also 170 additional beds, including chemo chairs, which is extremely important as we know the extraordinary numbers of incidents of cancer. Of course, there's additional outpatient clinics, new in-centre renal dialysis unit. This is again something that I've been fighting for hard in Ryde Hospital, but which we have been unable to secure. So it's fantastic that you've got those dialysis services, because they are in high demand right across all of Sydney. The new comprehensive cancer centre, additional cardiac capability, future provisioning of a nuclear medicine service. That's very innovative, and that's there at Blacktown and Mount Druitt hospitals. Expanded medical imaging, pharmacy, pathology and central sterilising services department. So these are all important things that feed into delivering a first-class hospital. And that was officially opened in May 2016. So that was what we got in stage one. But then, and again, my electors in Ryde will be most upset, there was a second stage. And the second stage of that more than $700 million project, so there's $400 million in stage two. And that project sees Blacktown Hospital transition to a major metropolitan hospital that services all of Western Sydney, and members should be most pleased that that service is in their backyard. And that project includes, at Blacktown, acute services buildings. So there's emergency department, intensive care unit, surgical and interventional services, psychiatric emergency care, there's endo, there's imaging, there's additional in-centre renal dialysis, women's health, birthing, newborn care, particularly important, and something that is close to my heart as a member with a hospital rebuild that's now had its birthing and maternity services pulled away because of this government's decisions. And I might use this opportunity to call on them in the forthcoming budget to restore the birthing unit as was promised before the election, as was expected and understood by people in my electorate. If it's good enough for Blacktown and Mount Druitt, it should be good enough for Ryde. I'm grateful that you've got it, but I want to see that in my community as well. There's nothing more important than making it easy for women to give birth close to where they live. Paediatrics, ambulatory care, and at Mount Druitt, there's investment in drug care, imaging, there's increased surgical services and additional renal dialysis spaces. Again, fantastic. All of that is in the hospital, but then there is incredible investment outside the hospital, a $24.2 million car park. The car park means that there's additional accessibility so that staff, patients, visitors can come in and see people at this new hospital. And why wouldn't they want to? I'd go there just to have a look at it. Such a fantastic build. And that became operational in 2014. So I might leave it there. I've got more to say, Madam Speaker, but I've run out of time. But I oppose the motion.
Question.